Thank you so much for joining us. My name is Mama Ponyamutai. I'm the CEO of Frey College. Welcome to the first lecture of our Africa Health Communication Fellowship. This is the first lecture that our fellows are having under this fellowship. And we thought it was so important that we make it public to everyone, because although the fellowship can only host so many people, our heart really is to share as much of this knowledge with as many people as possible, so that we make health communications in Africa better, and we save our people, and we save our resources, and we move forward as a continent. Just to get us started, I do want to first start by just giving some welcome. A first welcome, special welcome to our fellows. Thank you for joining us, and all of this is because of you. Thank you for applying, the time you took to apply and the time you took to be here. And we're excited for the journey ahead. And already we hope that even today, as Dr. Nsofor speaks, you will be edified, and already you will have practical skills and considerations that already help your communications to be better. So welcome to you, all our fellows. I would also like to welcome our partners who are here, the people we work with, particularly in the health sphere, like people like UNAIDS and SANAC, everybody who is a partner to Frey College, we welcome you. We also want to, of course, welcome our guest speaker. Thank you so much, Dr. Nsofor, for availing your time. We know that it's still very early where you are, so we really do appreciate, and we appreciate your heart to want to share what you know with other health communicators. So thank you very much. I am going to hand over to my colleague, Bridget Reed, who is the coordinator for the Health Fellowship, to again conclude the welcoming remarks, but also introduce our guest speaker, who will then take over. Thank you.
Thank you, Mama Ponya, and apologies for the technical issues at the start of this meeting. But we're very glad that you could all join. Welcome to all of you. As Mama Ponya said, this is our first public lecture for the the Africa Health Communications Fellowship, which has only started in the last this week, actually. So we're very excited to have Dr. Nsofor join us as our first speaker. He is a public health physician and a project manager. Sorry, if you can just give me one moment to get his bio back on the screen. Sorry, I'm having terrible technical issues at the moment. Yes, so Dr. Nsofor is a public health physician, behavioral science expert, and global health equity advocate. He's the project director of the Vital Project, an initiative focused on increasing HPV vaccine uptake through behavioral insights, social media, and community pharmacists across underserved populations in Nigeria. Dr. Nsofor is also a founder of the Behavioral Science Network, leading voice on evidence-based public health communication, and he combines storytelling, advocacy, and science insight to improve health outcomes in Africa. So he is the ideal person to start us off on this journey that we are starting with the Africa Health Communications Fellows. The session today is going to be 90 minutes. It's designed to be very interactive with 20 minutes set aside at the end for Q&A. We do invite you to introduce yourselves in the chat and let us know where you're joining from. We're also going to be sharing some links to articles that he has written and his website that you can all look up. But we're looking forward to a very interactive session. So thank you very much for joining us, Dr. Nsofor, and I'll hand over to you.
All right. Thank you so much, Bridget. Thank you, Mama Poya. Yeah, and thank you, Paula Frey, for reaching out to me to be part of this. Once she mentioned it, I grabbed it with both hands because it's something, health communications, storytelling, especially telling the African story, is something that I'm really very passionate about, that I think we should do more of. And I'm happy that this particular fellowship is also in existence, helping empower people to tell our stories and tell our stories. But I think quoting Chimamanda Adichie, ensuring that, we run away from the danger of a single story, because as far as Africa is concerned, that is what you keep hearing, one-sided story to what Africa is, who we are as a people, the challenges we face, the things we've been able to achieve, innovations across the continent. It's really left to Africans to tell that African story. And that's why I'm particularly happy to be part of this. So I think it's really very important for us to start on this note. I understand the fact that this is the first lecture, so this is the inaugural lecture, and I'm very, very happy and privileged to be the person facilitating this session. But to be honest, it's for me, every opportunity to share my insight is also an opportunity to learn. So this is a learning opportunity for all of us, including myself. So I don't claim to know everything about life, particularly I don't claim to know everything about health communications, or storytelling or use of data. So I want us to approach this session in that light. And having said that, let's also look at this session as a safe space that we should be open to offering our opinions. There are no right or wrong answers. And I think if we approach it that way, people are much more open to, share what they know, share their experiences without, feeling judged. But I think most importantly, I want us to have fun learning, because I think as adults, as we age or as we transit from, our adolescent to teenagers to adults, we tend to lose the fun in learning. I want us to bring it into this particular session, so that at the end of the day, all of us will leave this session enriched. So Bridget has already done this intro, so I won't say much about this, but I think I'll just focus a bit on the Africa Behavioral Science Network, which I co-founded with my colleague, Sohail Aga. What we're doing is, training African public health professionals to use behavioral science to improve health outcomes for our people across the continent. But I thought it very important to include this particular slide and these two recognitions, not because I want to show off, that's really not my style, but because I want to use it as an example of what telling your stories will do for you as an individual. Because as much as possible, I think beyond just telling the stories of Africa, I also want African professionals or African storytellers to get the recognition that they deserve as a people. And these are two recognitions that, telling stories of the African continent have really, given to me. One is being in 2020, being selected as one of the top 100 most influential Africans by the New African magazine. And also in the same year as COVID was raging, as one of the top 100 coronavirus top healthcare professionals globally. And these two are simply because, I started telling my stories, but most importantly, telling the African stories. Okay, enough of that. So let's now dive into it. Like I said, this is going to be a very interactive session. I don't know everything. I want to learn from everybody as possible. So I want us to focus on this particular image first. And I want volunteers, tell us a story about this photo. And like I said, there are no right or wrong answers. However, whatever it is that you see, however it is you want to capture it, in 30 seconds, tell us a story about this particular image. Who wants to go first? You can raise your hands or you just jump into it. I can also call people, which I do very frequently in my sessions. Who wants to go first?
I'll go first.
All right.
So I see what looks like a family of 3 Black women during a pandemic season, or probably COVID season, people wearing masks, petting dogs. They don't look like the dogs belong to them at all. It's in a suburban area. It looks like a CBD kind of place with the buildings around. Yeah, thanks.
All right. Sorry, who just spoke now? Because somehow I can't see the name of the person speaking.
Oh, sorry. Mtlotleng Mabena.
Okay. All right. Thank you. Okay. Mwenya, go ahead.
Good afternoon. So I would say that so dog therapy has been shown to provide support to people who are having a distressing time. And so during the pandemic, when there's been a lot of social distancing, this therapy has been provided in a park area to allow people to get the benefit of having interactions with animals. Thank you.
Awesome. Dog therapy. Okay, thank you. Rashida, were you going to speak? And I saw you unmuted yourself at a point. Okay, maybe not. So who else wants to attempt? So there are no right or wrong answers. It's what you see, because I assume that this is the first time you're seeing this photo. So whatever you say is correct. Who else?
Can I please go, sir? It's Kevin here in Cape Town. How are you?
I'm fine, thank you. Go ahead.
I'm good, thanks. It's winter. I see there's clouds. It looks like it's midday. It's in a suburban area. It appears as if the dogs enjoy by the ladies. It looks like they were taking a walk through the city.
Okay, your voice, it's like there's some connectivity issues.
And then happen to come across the masks. And as I said, winter. Is it better, sir? Yeah. So it looks like it's the way they're dressed in the clouds there in the background looks like it's an either an autumn or a winter's day.
Okay. All right. Thank you. Can we have 3 more volunteers to tell us the story about this image? There are no right or wrong answers. Whatever you say is correct. So it's what you see that, and how you say it and how the image appeals to you.
Yes, I want to say something.
Okay.
Yeah, to me, it looks like it's a day that is chilly in winter. It looks like it's in the afternoon. And then I see 3 young women that paused whatever they were doing just to show some kindness and some of their unexpected friends, the street dogs. That's what I can say about this picture. Yeah.
Okay. All right. Thank you.
Thank you.
Okay. 2 more people.
I'll go.
All right.
So one of the things that strikes me is the dogs. It seems to me like the family and the dogs are strangers. They're not petting them like their own dogs. So I also feel like it's a story of dogs that are welcoming to anyone and everyone.
Okay. Awesome. Okay. The last person before we proceed.
Okay, can I? Okay.
Sorry?
My name is Lisa.
Uh-oh.
It's so for
I can't really hear you. I think there's a connectivity issue. Your voice is scratchy, kind of.
Now.
Yeah, it's still, I can't make out what you're saying.
I'm saying that
to be honest, I can't. I can't. Can somebody else attempt? Maybe, hopefully, your network would improve eventually.
Okay, can I go next?
Yes.
Okay. So what I noticed here is that the dogs seem very tired. Probably they've been pet all day, so they seem very tired and sleepy. They're not interacting with the people, so it seems like this is some kind of a routine for them. Thank you.
Okay. Okay, so let me just take one more person, just in case if there's somebody who had attempted to say something but didn't get to it. One more person. Let me also look at the chat and see if people are saying things there. Any other person wants to attempt? There are no right or wrong answers. Whatever you say is correct. Yeah, go ahead.
Let me the chance.
Yeah.
Hello,
Okay.
sir.
Yeah, go ahead.
Okay. Well, I think probably I'm not so sure. Maybe it was the COVID era, and people are starting to come out and everything, and the kids are having a kind of a human-animal interaction, and of course the dogs look like they really love the rub and everything. So that's why I can get from the picture.
Okay. Okay, so can I just, can I engage you a bit? Okay, so beyond the, the people petting the dogs, what about the surrounding area? Anything comes to mind? Is there anything you want to speak to in the background? So the last person who spoke, I can't see the name when people speak. The last person who spoke, that question is for you.
Okay. I don't know. The weather looks kind of like, I don't know, maybe cloudy or something, and just a nice afternoon or something.
Okay. Okay. All right. Yeah. So really grateful to everybody who, who attempted. Like I said, there are no right or wrong answers. It's what you see, it's how it appeals to you. And every time I use this particular photo to facilitate sessions, it's usually very, varied stories that people tell. And I'm sure that listening to people who have said something, different things would have appealed to you differently. For me, one that really jumps out that I hadn't heard before, all the times I've shared this photo, is the fact that, this is like a dog therapy session. I hadn't heard that before, which is really, again, gives credence to the fact that for me, anytime I facilitate sessions, it's an opportunity to learn. But we're going to get back to this photo eventually. Let's just proceed. Okay. This particular quote is really, really, really very important, I think, from the Op-Ed Project. The Op-Ed Project is a New York-based, women-founded, women-led organization that trains people on how to write opinion articles. And I like this particular quote. Whoever tells a story writes history. So let me come back to you guys again. How does this resonate with you? What do you think, about this particular quote? And maybe use an example to buttress what you're saying. Who wants to go first? Particularly people who haven't spoken at all. Anybody wants to have a go? Whoever tells the story writes history. The Op-Ed Project. Who wants to attempt? Okay, I will start calling people then. Philly Mjoli. Do you want to attempt? How does this particular quote resonate with you? It's from the Op-Ed Project. Whoever tells the story writes history. Okay, it seems to be having connectivity issue. Brooke Ruger.
Can I
Hello?
go?
Yeah.
Yeah.
Sorry, I had some connection issues. I missed
Okay,
what you
so
said there.
okay, go ahead. And after you, Brooke, go ahead. Go ahead, Philly. You said you had your connection has improved, right?
Yeah, but
Tembiso here.
okay.
Okay,
Tembiso
Brooke.
here once. Mm-hmm.
Brooke, go ahead. After Brooke, then Philly, you can speak if your connection is fine.
Okay. No, he can go ahead because I missed the part where you were talking because of the connection. So
I would love to
Okay.
go ahead.
All right, go ahead, Brooke.
All right. So this is Tembiso here. For me, when I look at this quote that says, "Whoever tells the story writes history," I'm just reminded of how stories make, an impact into our lives. Some of the things that, are passed down through generations from our ancestors, our family members. And now they're actually making an impact into our life today. I'm just taking an example with my own life. I'm still living life the way that, my grandmother taught my mom, and, how my mom then passed down the information and taught me. So I think the impact, that lies within storytelling is just, get stuck with us for a very long time. So that's why I believe that whoever tells the story writes history, because in future, future generations will remember, these stories, because once they begin to connect with the stories, then the stories will make an impact, a lifelong impact in their lives. So that is how history is. Thank you.
Okay, hold on a bit. So can you share with us, very briefly, one of those stories that your grandparents told you that still resonates with you to date?
For me, it has to be about my growth as a person, and how I'm supposed to look at the world. I believe that my father comes from a family that was struggling quite a lot. From his upbringing, from the deep rural areas, to then finally being able to afford to get himself a house at the age of 16, after having lost, his family members in a certain genocide that took place in his upbringing, the rural areas that he grew up at. And he's now the sole survivor of his family. So he keeps on reminding me, every time I find myself, having so many friends, going out with friends, having different activities with different people, he always comes back to me to remind me that, hey, Tembiso, you must always stay focused. You must always remember that you must stick to your lane. And then once your lane is clear, then you can begin to invite other people into your life. You can't invite other people into your life whilst you are still in a journey of self-discovery, of growth, of, success. And then you now have people in your life. Some of them might actually drag you down. So it is more about those teachings of, trying to focus on myself, focus on my vision, focus on actually, making my life better, more than just, being out there, with the people and just being mischievous. So I'm very careful nowadays. And I also, teach people around me to also, be careful of how their surroundings and how their relationships can actually influence and impact their future, sometimes negatively.
Yeah. Okay, awesome. Thank you so much, Simbiso. Thank you for sharing. Can we have 2 more people volunteer how this particular quote resonates with you, and maybe use an example? Okay, go ahead. Sorry, who just spoke? Okay. Your connection is not very, I can't hear you very at all. I just hear sounds, but I can't hear you. I can't make out what you're saying. So sorry about that. Can somebody else
Can I give it a go?
Yeah, go ahead.
Okay. So I think for me, when I read this quote, I think about how we look at history as a subject. So oftentimes, we rely so much on the written record. We rely on archaeological findings. We rely on stories that people tell. So there are oral histories from time to time. But I think out of all these, the written record usually tends to have the strongest evidence.
Yeah.
And you would find that when we examine these written records, we get a perspective about the history of people and places. And this is in the perspective of the people who wrote at that time. I remember reading a book where they were saying that African history is difficult because there are no written records. And the records that exist were not written by Africans, but by people who observed them. So you find that even our history tends to be lost because we maybe did not write it down. It was passed through oral traditions, and the known history that is there isn't from our perspective, but from the perspective of observers. So if you write down your own history, you are able to kind of pass down the real picture or the real story of you as a people, as a place to future generations. So if you are the ones who are writing it down, it will be your perspective that comes through to whoever is looking back into the past, that's looking at these records.
All right, and I think your perspective is quite spot on, because it's not just telling the stories orally, which we're very good at across the African continent. I can, not just like the first speaker, I can actually still remember stories that my grandparents and elder cousins told us while we were growing up, but documenting those stories. But I think most importantly, documenting those stories as an African, as opposed to somebody coming from elsewhere to the continent and documenting that story through their own gaze, or what is called foreign gaze. So I think your perspective really resonates with me. It's really very important for us to document the stories. So let me take the last comment before I proceed. Miriam Oshodi, your hand has been raised for a while.
Yeah, my hand is up.
Okay,
thank
go ahead,
you.
Miriam.
So my perception to whoever tells the story, writes history, is the fact that it's important for us to ensure that we document. It's important for us that we...
You're muted.
Yeah, can you hear me, please?
Yeah, go ahead.
Okay, so my perception of whoever tells the story, writes history, is the fact that it's important for us to document whatever thing we want to say. Yes, just like someone had rightly said, some stories that had our grandparents, our older family members, some of them who are already deceased, have told us. And you remember some of those things. Some you might even want to pass it down to your own younger generation. Some you might even forget. But if you would actually write some of the stories, you write some of these things out, it becomes part and parcel of history. Just the same way we look at events in the African continent, and when we are saying these stories, we're able to, once these things are properly documented, people that come after us are able to relate with those things, and they're able to put it into perception. So for someone who writes it down, it's forming part of history, and you're trying to keep the information as undiluted as possible. So that's what I think about. That's my perception. Thank you.
All right, thank you so much, Miriam. So Ambelu, you can speak before I continue.
Okay, thank you, Doctor. Whoever tells the story, writes history, means understands that it's the reflection of events that become accepted as history. It's often shaped by the perspectives and intention of the storyteller. I think those who have the power to narrate events like when COVID-19 or something, wars happened, through writing or media or oral tradition, that can be how those events are understood and remembered by the future generation. Today's event will be a part of future's history. The phrase emphasizes the power of storytelling and reflect reality also. Thank you.
Right. All right, thank you so much. So this is a second quote by the Op-Ed Project. And as you can see, it relates, to the first one. The story we tell becomes the world we live in. So it's important for us to tell our stories. The people who have commented have said, it's important to document those stories. It's important for us to tell our stories from our own perspectives, from our lived experiences as Africans, because I think nobody understands Africa more than we do, because we were born there, we grew up there, we face all the challenges and all the successes and triumphs that we have. But most importantly, whatever stories are told now become the world that we live in. It's as simple as that. And an example I want to use for this is, so I did my master's at the Liverpool School of Tropical Medicine, which I think is the best school in the world. You can argue with your laptop if you disagree. And when I was in Liverpool, you were supposed to go to a developing country for your research. If you're from a developing country, you will go to one that is different from where you're coming from. So I ended up, doing my research in Zambia. And I was in Zambia for 8 weeks. By the time I was done with my research, of course, I couldn't come back without going to this, to the famous waterfall, the Victoria Falls. And I went with my research assistant from Lusaka. We went to Livingstone, really had great fun. And it was while I was there that I now realized I learned the true name of, Victoria Falls, Moasitunya, which means the cloud that thunders. But up till date, that particular waterfall is still called the Victoria Falls, because a man, a colonizer from the present-day United Kingdom, came all the way to Zambia. The local people took him around. He saw the waterfalls and said he discovered it and now named it after Queen Victoria. But despite that being the wrong name of that waterfalls, that name still persists up till date. And if you look at the name of the waterfalls in the language of the people, translated into English, which means the cloud that thunders. Anybody who has ever gone to that particular waterfall would understand why the people who owned the waterfall gave it that name. Because from the height of the waterfall, the water hits the ground. You just see it's like a cloud of water vapor. That comes upwards. And this kind of false narrative, litters the African continent, litters our literature, where somebody really comes and tells the wrong story, essentially. But guess what? The story of the Victoria Falls or Moasitunya is still in our literature. People who go to school still recognize it. That's what they are taught at the Victoria Falls. And it's simple. Whoever tells the stories, write history. The story that we tell eventually becomes the world that we live in. And I want to bring it to global health now, since this is that is where I work, and this particular intervention is specifically for health, telling stories in health. When you think about it, the stories that you predominantly hear about the African continent is that of disease, poverty, people who don't know what they are doing, people who require somebody from outside to come and save them. And yet, if you walk within the African continent, if you walk across the health space, you will see how our people are really innovative in the work that we do, how we lead in several areas. We've made reference to COVID-19 from the first photo that I shared. If you look at the fact that even the Omicron virus at a point in time was South African scientists who discovered it, that enabled the world to come up with the right medication and vaccines for it. That particular discovery led by African scientists ended up coming to hunt Africans, because even Africans traveling became an issue. When people see you and think that they see the coronavirus. And for me, this is really why it's very important that fellowships like this exist, so that we can tell. We're not telling you not to talk about the challenges that we face. No, we're saying, let's have a balanced view of what is happening. One of the work that I did way back was, co-leading the evaluation of the African Union's intervention to end the Ebola outbreak across Guinea, Liberia, and Sierra Leone. The African Union deployed the largest contingent of volunteers that were all Africans. And by the time we got to those 3 countries, within 2 weeks, traveling and interviewing community people, ministries of health, different international partners working there. What came out strongly to us was the fact that if the African Union volunteers hadn't come when they came, that Ebola outbreak wouldn't have ended, as quick as the time that it ended. And this just, but you didn't even hear that in the news. People never spoke about it. And interestingly, when we did that intervention, when we did that evaluation, the Africa CDC was not in existence. One of our recommendations in our report was the establishment of the Africa CDC to lead epidemic preparedness and response for the African continent. So I really cannot overemphasize why it is important for us to tell our stories, document them, and ensure that it becomes the world that everybody lives in. Which brings me to this particular slide. At the end, when the epidemic phase of the pandemic ended, the WHO did an evaluation of the different continents to say, how did the continents perform? And this is a statement by Dr. Tedros in his report, in his speech at the launch of that particular report. The WHO found out that Africa is the only region to have developed a unified continental strategy on COVID-19, and that strategy has delivered results. But you don't hear this in the news. And unfortunately, we really cannot wait for people like David Livingstone to tell our stories. We need to tell our stories. We need to tell our successes. We need to tell our challenges. And I can assure you that Africa is a continent with so many countries. When we tell our stories from our different perspectives as Africans from different countries, it will differ. It will enrich the experience for everybody. But most importantly, it will correct history, which I think this is one of the goals of this particular fellowship. Okay, so in 2019, just before COVID, when I went to the University of Global Health Equity for an executive education on health equity, nobody knew COVID was coming, but I went there as an Atlantic Fellow for Health Equity. And it was a 2-week course, we had sessions in the classroom, but most importantly, we went to the communities to shadow community health workers to learn, how they provided services to the people of Rwanda. Now, this particular, statement was in the first classroom that I walked into when I got to University of Global Health Equity in Butaro, on Rwanda, which is about 3.5 hours, 4 hours from Kigali. And I just couldn't help myself, because when I saw this statement, it was a validation of everything I was doing, before then. Because for me, in particular, I'd always seen the importance of people. We need to change the way that people think and act. But for us to change that, we need to educate people. Once I saw this particular, statement in that classroom, I had to take a photo under it. So this is not a graphic that I created. This is actually an image. I took a photo under it. My friend from Ghana, Dr. Elliott, took this photo. And I totally agree with it. Achieving equity in healthcare depends on equity in health education. So let me take a 5-minute pause, and I want to hear from you guys. What do you think? Yes or no? Do you agree? Do you disagree? Use an example, to buttress your point. Maybe we'll take like 3 people before I proceed again. Anybody who wants to go first? Achieving equity in healthcare depends on equity in health education. Who wants to go first? Okay. Yeah, go ahead. Florleng Mabena, go ahead.
Okay, sorry, I was giving other people an opportunity if anybody else had a hand. I think it's an absolute fact, because if people don't know what health issues they have and how to respond to those health issues, then they're not going to know what it is that they need and deserve. So we have to educate people on their own selves, their own needs, and solutions, so that they are able to then reach out and ask for the solutions that they actually need. Thanks.
Okay, hold on a bit. Let me engage you a bit. So when you say people, who are the people you're talking about?
Everybody, every human being who is living, who needs a health service at some point, whether it is preventative, promotive, curative, rehabilitative, anybody who's a human being who at any point needs any health intervention.
Okay, all right, thank you. Who else wants to go? I need 2 more people before I proceed.
Can I?
Yeah, go ahead, Wongani.
Yeah, I think you can look at this from different perspectives. You can look at it from provider or from the people whom you're caring for. So because of my profession, I'll take it from the provider's perspective. So one of the things which we note on the African continent is that, for example, we lack specialists in many different fields. So we don't have a lot of people who treat cancers like oncologists. We don't have specialists who can do cardiothoracic surgery and all those other things. And because we lack these people with all this expertise, it means that our people are lacking essential services. So the quality of care, the level of care they're getting is not on par with the level of care other people outside the continent are getting, for example. So if we are going to address this gap, we need to make sure that we also develop that expertise within our setting. So we need to achieve equity in education so that the experts we have here are on par with experts everywhere else, and that we have them in sufficient numbers. So if we achieve equity in this realm of health education, then by default, we are ensuring that the people we care for are able to access more and better services. So from the perspective of the provider, that's how I would interpret that statement.
All right, thank you, Wongani. Spot on. Faith Lukonde.
Okay, yes, good afternoon.
Yeah.
Am I audible?
Yes, I can hear you, go ahead.
All right, so yes, it is. I think achieving equity in healthcare means everyone has an equal opportunity to access quality healthcare. And that's regardless of their background, income, or location. But this can't be achieved without equity with healthcare. I mean, with health education, in health education. Now, think of health education like the foundation of a building, yeah? If the foundation is weak or uneven, the entire structure is compromised. So similarly, if people lack access to quality health education, they'll struggle to make informed decisions about their health.
Okay, all right, I agree. Thank you, Faith. Okay, Yamikani, you just raised your hand. You want to briefly say something? Okay, Rashida, go ahead.
Yes, actually, what I wanted to say is a bit similar. Just wanted to add a little bit. That's I totally agree with that. Yes. Also, what I wanted to say was it also partly that was mentioned by Paula in the comments.
I'm so sorry, Yamikani. I can't hear you. You know, there's a problem with your connection.
Okay, can you hear me now?
Yeah, so I can hear you talk, but I can't make out what you're saying. You know, can I just take somebody else? Why? Okay. Okay, Mama Ponya, you want to say something? Mama Ponya?
Oh, sorry, there's a number of people who logged in with my link, so they're all called Mama Ponya, and maybe he's not aware.
All right.
Yeah.
Okay. Okay, that's fine. Okay, Rashida, go ahead. After Rashida, Sylvia, then I'll continue. Rashida?
Okay, so I just wanted to chip in. You know, equity in health education is about ensuring that everybody, regardless of your financial status or where you stay, you have access to quality health information. And of course, this kind of like gives you, then if you have access to quality health education, then you are able to make an informed decision about accessing care. Take for instance, I think during the period of COVID-19, remember when because of so many means of information out there, people, you know, information about the vaccine, misinformation about. Hello?
Go ahead, Rashida.
Can you hear me?
Yeah, go ahead.
Okay. Misinformation about the vaccine, misinformation about people using different things for, to cure COVID-19. People are unable to actually go for those who had COVID-19 then because of the, so that's about you now talking about equity in healthcare. Because there is already a lack of equity in health education, definitely people won't be able to, actually say, okay, they want to make informed decision about accessing quality healthcare. So health education is really, really important before you can even thinking about access. Thank you.
Yeah. All right, thank you, Rashida. Okay, Sylvia, speak, then I can continue. Sylvia, go ahead.
Thank you very much for the opportunity. So I just want to share that I quite agree with your opinion about achieving equity, which is on equity in health education. So health education is very key to preventive. It's a preventive form of, it's a way of preventing diseases or infection or whatever you have, mitigating impact of all of these issues, talking about outbreak and because of misinformation.
Your network has issues. Okay. Yeah, but I get the meat of what you're saying, Sylvia. Thank you so much. But I need to process so that we can buy time. I'll call you up again. Hopefully your network must have improved then. Okay, yeah. So let me also say, again, reiterate the fact that this quote is from the University of Global Health Equity. I went into a class when I got there and I saw it on a wall in the class. Achieving equity in healthcare depends on equity in health education. So I just took this photo under that statement. And I think somebody has, alluded to that. But I think that most times when people see this quote, automatically you think about, people who are seeking healthcare. Somebody spoke about the fact that, since a number of African countries lack access to specialized care, we need to train more specialists in those areas to achieve equity, which is fine. And if you look at it, all of us really need to improve our knowledge. It's not just community people. It's not just, sorry, who is speaking?
Yes, house.
Please, can you mute? Okay. So going back to that quote, achieving equity in healthcare depends on... Lara, please, can you mute your mic? Thank you. So going back to that quote, achieving equity in healthcare, achieving equity in healthcare depends on equity in health education. It's really for everybody in the ecosystem of health. Just like some people have said, community members, yes, we need to improve knowledge of community members about different health issues. And I dare say about also holding government accountable for providing the services that, government say they would provide. In my days in Nigeria Health Watch, and that also still continues up to date in Nigeria Health Watch, there's an initiative of Vote for Health Niger, where Nigeria Health Watch colleagues will go around asking people questions about, especially during elections, so that our people can know about the health issues to insist that political leaders should provide. So improving our knowledge is across the board. Healthcare workers, you also need to know about easier and much more effective ways of communicating with our people. Politicians need to know that, look, it's not just coming to say you're going to give free healthcare. There's no free lunch. Somebody's going to pay for it. How do you ensure that, we have the necessary resources to ensure health equity, especially in the face of dwindling foreign aid at this point in time? Politicians need to know more about how to ensure that Africa is self-reliant as far as funding development is concerned. Policymakers, journalists need to know that it's not just writing about sensational stories, but really writing stories, one, that will improve the knowledge of our people, but also equip our people to demand for better healthcare and better social services from our leaders. And religious leaders also need to know that, look, they are very powerful people. They are very respected and revered. For us to achieve equity in healthcare, we need to educate our religious leaders on what not to say. If you're conversant with the social media in Nigeria now, one of the religious leaders, Pastor Chris, there's a controversy now about why people he's saying that salt is not a big deal. People should not be bothered about their salt intake. But for us as health workers, we know that that is wrong. So that's an example of how a religious leader can say the wrong things that would really not help our people achieve health equity. So improving knowledge here, improving health education is for everyone. But of course, depending on where it is that you operate within the ecosystem, the knowledge that you need to have or the improvement in that knowledge would differ. So let me proceed. So that, for some years now, this is in telling global health stories. I've tended to use this formula. And for me, it's my attempt to really, simplify the process, because I think when you tell, just like I told you guys when I started with that first image, tell me a story about this image. People attempted and told the stories from their own perspectives. But you see, most times you get a different response if you tell people to write a story about that particular image. People think it has to be something that is complicated. But for me, it shouldn't be, which is why for me, in order to tell global stories, I think this formula, is something that you should consider adopting. It's going to help you articulate your ideas better. And it's problem, solution, call to action. So what is the problem you're looking at? The problems are many. If you have identified that problem, of course, you're going to back it up with data. What are the data sources? The solution. What are the solutions? Most times you would see that, again, looking at different data sources, you're going to find the solutions to that problem. But ultimately, for you as a storyteller or somebody who writes or tells stories through different platforms, what are the calls to action? What do you want people to do? And what you want people to do would differ depending on who it is that you want to take the action. So problem, solution, call to action. And for me, beyond just having that particular formula, it's also, you have to find a way of weaving that story around what matters to people. And I think most times as health workers, as scientists, as people who produce knowledge in different forms, we really think that what matters to people sometimes will be a very complicated issue. But I'm going to show you, and I hope that some of you got to read the reading list that I shared of 3 articles that I wrote. Because what I try to do is that you need to weave that formula of problem, solution, call to action around something that people care about. And what they care about most times may not appear that serious to our people. But ultimately, if these are the things that matter to, these are the kind of stories they want to hear. So how do we tap into those stories that matter to our people and using those stories as the vehicle to deliver something that is very serious and something that is important for their health? But I need to hear what you think about this formula before I get to those 3 articles. Let's have like 3 people, tell us, so problem, you define what the problem is. For you to define that, you need to look at data, different data sources. The solution, to be honest, most of the solutions are already there in literature. You can pull out the solutions and put it in your own words and make sure you give, proper reference to where you got those sources from. But I think most importantly, what you bring, to that particular story is the call to action. But these 3 things woven around what matters to people. What matters with people most of the time are things that are topical. So for instance, this particular controversy of the Nigerian pastor is a topical issue. It's something that you can plug in to tell the story and the call to action that you think different people should take regarding what the pastor is saying about people not being bothered about salt. And we know that, high salt intake really leads to, all sorts of cardiovascular issues. So I want to hear what you think, and if you agree with this particular formula, maybe help us with a particular story that you want to apply this formula to. Let's take 2 people, then we can continue. Who wants to go? As usual, there are no right or wrong answers. It's the way, it's your story. If you think about a story, you think about a problem, think about one solution, and think about one call to action that you would want a certain group of people to take as far as that story is concerned. Okay, Brooke, go ahead.
Thank you. So I was thinking about a recent story I did. It's about the problem of traditional bone setters in Ethiopia. So mostly when people encounter some kind of problem like fracture or a dislocation, they usually prefer to go to traditional bone setters rather than orthopedic surgeons or medical professionals. And there have been so many sad and devastating stories regarding complications as severe as amputation and even death. So we can identify this as a problem. So there's a project being done there. So I was attending what they were doing, and they were training those health professionals at every level. So at health centers, at health posts, there were manuals prepared for health professionals that are working at primary level or secondary level as well. So they're also integrating those traditional bone setters because making them stop the work is not plausible, or is not something you can achieve in the immediate or even in the medium term. So it's they've started adding them to WhatsApp groups and using interactive teaching sessions. So those are part of the solutions, and creating awareness to the people who seek those traditional services through using different media platforms, including social media and legacy media. So that's what came to my mind when I thought of it. Thank you.
Okay, thank you so much, Brooke. Interestingly, I was having a discussion with a group, last week or 2 weeks ago, and this traditional bone setters came up. Yeah, thanks for sharing that. And, because our people trust these people. So we can't throw away the child with the bathwater. We have to look for innovative ways of integrating them because people trust them, but also ensuring that in doing that, our people are not harmed in the process. Any other person who wants to share? Problem, solution, call to action, woven around what our people care about.
Can I try?
Yeah, go ahead, Philly.
What I
can
think
share about a problem in Malawi about unsafe abortion.
Okay. Go ahead. Okay, I think so. I think there's a confusion. Okay, let me just say, okay, Endurance. I think you should speak after Endurance, then Philly. Endurance, go ahead.
Okay, thank you very much, Mr. Ifeanyi, and please confirm you can hear me, please.
Yeah, I can hear you.
Okay, yeah. I want to tell a story based on these 3 formulas we've given. You agree with me that there once upon a time in Nigeria when we had HIV and AIDS to be a very serious case in Nigeria, where in fact they even gave it a code name 7+1, which is 8. And you know how people are being stigmatized as to no, if you have HIV, it's like you're actually living a very not so spiritual life in quote. And that has actually been a problem for people, even those that were even living with HIV and AIDS. They couldn't come out to say, okay, they are actually positive to this disease because of the fear of being stigmatized and the stigmatization. So the death rate actually increased then. But I think with for the solution now, with the way we have actually put awareness in place, everybody is now being made aware that at least there's ARVs in place that actually will help the multiplication of the virus in our systems. I think a lot of persons have been made aware by that awareness campaign that have actually been put in place, and a lot of persons are now desensitized as to, especially with the laws in country now, because it's actually a very big case for one to actually discriminate or stigmatize against persons living with HIV, and it's even a punishable offense with even being imprisoned. and that has actually curbed the way people go about discriminating and stigmatizing persons living with HIV and AIDS. That has actually contributed to being part of the solutions to persons living with HIV and AIDS. And for the call to action now, everybody is now made aware that HIV is not really a death sentence, and people, we even have real life situation of persons living with even the HIV and AIDS for close to be 20 to 30 years now, and they are still very much alive. Thank you so much.
All right. Thank you so much, Endurance. Philly?
Hello, everyone. Mine, the problem that I see, it's a story that I've written a couple of times, trying to highlight the problem that we have of the smoking problem, especially among the youth who are in tertiary and high schools. My focus is always on the e-cigarettes and the vapors that youth and other people use, thinking that they are not dangerous as the smoking cigarettes. Actually, that's the problem I see. The solution is that there are some policies that have been designed in order to keep that these cigarettes or the vendors or the stores are not supposed to be near to the schools or colleges. But so far, it's still the youth can access those and still thinks that it's safer to smoke vapor or e-cigarettes. I think the call of action is to do more campaigns about dangers of smoking in general, focusing on these new things that youth thinks they are safe and they are good to use because they believe that if you smoke these things, they're different. You're not like you are smoking if you are using it. I think we still need to do more campaigns, even though there are policies there in place. I think we need to go more on that area just to make people aware, especially our youth. Thank you.
Awesome. Thank you so much, Philly. Okay, Ayele, you can speak, then I will continue.
Thank you, Doctor. I'm thinking about the main problem is bridging the health gap Ethiopian Health Extension Program. And early 2000, the main problem is in the early 2000s, Ethiopian faced a critical shortage of healthcare workers, particularly in rural area. This scarcity led to high maternal and child mortality rate and limited access to basic health service. So the main solution is the Ethiopian government launched the health extension program in 2003 and deploying over 40,000 trained health extension workers. So to provide essential health service at the community level. This service includes immunization, family planning, health education. So it's a great impact. Now, it's not going well. It needs to a revision for my call to action, focus on the government invest more and reactivate this community-based health program and workforce training to enhance healthcare accessibility and equity, especially in underserved areas. Thank you.
All right, thank you so much, Ayele. And I mean, this is an important segue to, to the fact that, I think most times, so it's very clear that whatever it is that we're doing has to be data-driven. So identifying the problems, data-driven. Identifying the solutions, data-driven. The calls to action, to a large extent, data-driven. Some of it may be you as an expert who is writing about it and what you think, should be maybe an innovative way of doing that. But I think one data-driven fact in global health that I don't know whether governments are really blind to this, whether even donors are blind to this, but the WHO says that 80 to 90% of the healthcare needs of any individual throughout that person's lifetime can be provided at the primary healthcare level. You know, and for me, that's such an important information that I think should guide healthcare delivery anywhere, not just across the African continent. But from what you said earlier, the fact that at a point in time, due to the paucity of healthcare workers, you know, people were dying, maternal health indices were worsening. But at the end of the day, the solutions were also not complicated. There were community health extension workers, people in those communities that could provide the basic primary healthcare services. That, you know, led to improved survival of the people across Ethiopia. So thank you for sharing that. And thanks to everyone who has shared. So let's focus on these three, you know, stories that I told. And I hope that at least one person got to read it. The first one was on Chadwick Boseman, the Black Panther. You know, unfortunately, when he died, so before then I had written some, you know, articles for NPR Goats and Soda, and the editor reached out to me, you know, I think a day or so after Chadwick Boseman's death was announced, and asked me, fine, what do Africans think about Chadwick Boseman? Do you want to write about it? I said, say no more, because for me, after watching the Black Panther, I looked at Chadwick Boseman as a great African king. I looked at Wakanda as that, you know, that's the kind of Africa we want to have, very powerful Africa, resourceful, great leadership and all. And once I got this opportunity to essentially write a tribute to Chadwick Boseman, I did not waste that opportunity at all. And this title of A Great Tree Has Fallen was taken from my Igbo culture. Because in my Igbo culture, which is also the way I started this particular article for NPR, in my Igbo culture, when a king dies, you know, we say that a great tree has fallen in the land. And in Igbo, it says, Oko sisi adala n'obodo. But we also believe that when a great tree falls, it's not the end of that tree. It's an opportunity for roots to sprout where that tree touches the ground. And essentially, that tree lives on, which is also what I brought to that story. And if you've watched the Black Panther, even Chadwick Boseman, you know, also alluded to that when he was talking about when he has had an opportunity to engage with his father, you know, saying that, you know, when you die in the African culture, you live on. But enough of that. But what was important in this, going back to that problem, solution, call to action, was the fact that across the world, you know, the Black Panther really resonated with most people. So it was a story that most people were really interested in. But what I tapped into in that story was the fact that, unfortunately, Chadwick Boseman died from colon cancer. To show that, look, in as much as, you know, we honor him, we thank him for his services to the film industry, the way he, you know, he projected the Black race. But let's focus on what killed him, and the fact that, you know, this is still killing, you know, Africans, especially people of Black origin, males. But what even made me think about that was that when I was doing my master's in Liverpool, Jane Goody, who was a Big Brother celebrity, unfortunately in 2019, she died of cervical cancer. And Jane Goody's death led to an upsurge in screening for cervical cancer, which was called the Jane Goody effect. So I felt that it was an opportunity, you know, for us to have a Chadwick Boseman effect, where more people will screen for colon cancer, and ensure that, you know, we have the services that we need. But unfortunately, I also highlighted the fact that, just like somebody has said already in this particular course, we don't have specialty for some of these. We don't have the adequate health workforce across a number of African countries that will provide that. So let me see, maybe just hear from two people. Did anybody read this particular piece? What stood out to you about that piece, and the way that I used a topical issue of Chadwick Boseman's death to tell a global health story and advocate for colon cancer? You can raise up your hand so that I just know the person who is speaking. Did anybody read it? And this is not putting you guys on the spot, but I just want to see if somebody can hear people's perspective about that piece. Did anybody read it? Do you want to share? Anybody? Okay. Okay, Tresfai, I hope I'm pronouncing your name right. If I'm not, I'm sorry. Go ahead, Mark.
Yeah, good afternoon.
Yeah.
You pronounced it right.
Mm-hmm.
So I roughly tried to see the story. It was really interesting for me. Starting from this great actor, Black Panther. So the intro was very clear. To start with Bosman's history, then how he was diagnosed with colon cancer. Then the problem with the colon cancer, then the solution was set there. Screening, something like that on issue of colon cancer. So the author has brought a solution as a call to action for the global community. And also it touched the history of the, I think, UK diagnosed cancer issue. Then it was taken as an example because the politicians has called the screening of cancer after the days of that particular filmmaker. So it was it was attractive for me to attract individuals' attention based on the history of an individual, because so it has the problem, the solution, and the call to action in short, based on the formula we have discussed earlier.
All right. Thank you so much, Tresfai. Okay, Yamikani, briefly, then Mariam after you. Yamikani, go ahead. After Yamikani, Mariam, you can speak.
Okay, thank you so much. When I went through the story, what stood out most was, of course, how you brought the movie back to our faces, then also made us see what Chadwick should watch during the movie. Despite that he was suffering from cancer, was able to defy all odds, but then should the movie make it compelling enough that nobody could miss that he was battling with cancer. And also at the end of the story that I read, made me go back and also maybe watch the movie again, and maybe and even research more about colon cancer for me to appreciate the kind of fight like Chadwick was doing. So I think that's what stood out for me most, because it brought it brought a feeling that it wasn't just a movie, but it was an informative kind of movie for the experience, the life of Chadwick anyway. So where at first maybe people didn't know that maybe because you have got cancer, you cannot do this. You cannot shoot a movie, you cannot be a star, you cannot inspire others. So it also actually also made a call to action actually in the end. That I think there are lots of ways on how to maybe get the message out there. That
Okay. Okay. I'm sorry, I really can't hear you again. But thank you for sharing. Let me hear from Mariam so I can proceed. Mariam, go ahead.
Okay, yeah, thank you. So this is Mariam Ileyemi from Lagos, Nigeria. So I read the opinion piece this morning, and I particularly like how you were able to like carry us along, sharing how the movie stood out, and also some of the interventions that the movie also spoke to. And then you went into health education, highlighting how people eventually went for screening, how they recorded high people coming into the hospital to screen for colon cancer and all. So after reading the piece, what came to my mind is the issue of, you know, our attitude to infection prevention and control. Why do we have to like wait for an effect? For instance, like the this man dying before we like go to hospital to check, and also why do the authorities have to like wait for an outbreak before they start, you know, doing testing, before they start doing their disease surveillance and all? So I think it was a great piece, and it's only what resonated more is this issue of high PC for me. Thank you.
All right, thank you so much, Mariam. Thank you. Okay, so this second piece, I mean, anybody who knows the Nigerian music industry knows that we have great artists. So Buga, you know, was a hit song, still a hit song by what's his name again? Anyway, so when I saw the video of Buga, and I remember about that particular day, I watched the video when it was launched on YouTube, first time it came out, because I love that Buga song. And one thing that stood out to me, like, I think by the second minute or so, if you look at the timestamp, I saw this particular lady, you know, using her teeth to open to open a bottle of beer. Immediately, I was like, how can you do this? This is going to damage your teeth. And quickly, I reached out to one of my colleagues, Dr. Adekemi, who is a dentist. I said, Adekemi, I think we need to co-author a piece. One, again, because Buga is a hit song, the video launched, it was topical, it was trending, it was an opportunity for us to plug in. And that was what we did. So we co-authored this piece for the African Argument. And, you know, look at one of the paragraphs in that piece. As Nigerians, the infectious song by Nigerian artists make us feel proudly Niger. However, as medical professionals, there's one moment in the video that worries us. We are dismayed by the shot in which a female dancer uses her teeth to open a bottle. We all know too well the dangers of this risky act from regretful and suffering patients we have seen ourselves. We fear that such a widely watched video could lead people to mimic the dancer's actions and similarly cause themselves serious harm. And we went ahead, you know, to show, you know, what the complications could be, how it could even disfigure your face, it lead to mental health issues and all. But just like the story on the Black Panther, what we did was to use something that was topical. People love the Buga song, Kiss Daniel and Tekno. When this video launched, it trended, you know, within minutes, you know, hundreds of thousands of views on YouTube. And it was an opportunity for us to plug in problem, a solution, then the call to action, what we wanted people to do. But most importantly, we wove it around what mattered to the people, which was Buga. And this is really to show that sometimes what matters to people, and you may think our people are not serious-minded. It's okay. The important thing is that what matters to people, you know, would become important vehicles for storytelling. But using data, storytelling, you know, to drive that advocacy. So let me share the third one, and then I can take comments before I round up. This one I wrote for Project Syndicate, Decolonizing Global Health Leadership. For this particular piece, interestingly, again, reading the news, I saw that my fellow countryman, Professor Muhammad Pate, who is now the Minister of Health, coincidentally, for Nigeria, was appointed the Gavi CEO of Gavi, the Alliance. And I was like, oh, this is great. As somebody who has spoken a lot, written a lot about decolonizing global health leadership, I felt that this was something to write about. But even in writing it, to show that while it's a good step for an international NGO like that, it's still really a drop in the ocean if you think about it. But look at the irony. Just before he was supposed to enter that position as Gavi CEO, the president of Nigeria appointed the Minister of Health, and he gave it up. But I was happy that in his place, the Gavi CEO now is from Pakistan, is still disadvantaged population as far as global health leadership is concerned. So can I hear from two people, you know, if you read the one on the Buga or this one on decolonizing global health, what resonated with you? Then I'll just round off in the next 5 minutes. Anyone, you can raise your hand so I can see you and know exactly who is speaking. Did anybody read any of those ones? Okay, Moanya, go ahead.
Thank you. So I like the one on the Buga because you're right. It was a very catchy song, and it was, used everywhere. So it was played. So I'm in Zambia, but it was played everywhere. And so reading the article, it brought back the song, but it made it relatable. So when I read that, and then I heard someone's ringtone using that, it actually took me back to the article. And so I thought it nicely gave a nice way to remember the importance of oral health as well. And I think, and it's using something that is so ubiquitous, like it's so widespread that it's a very easy conversation to bring up. So I thought that was very interesting. Thank you.
All right. Thank you so much. Stembiso? Okay, okay, Stembiso is entering the room. Any other person, did you read the Buga one or this or the decolonizing global health leadership one? Any other person wants to share? Yes, no, yes, no, yes, no, yes. Okay. All right, but I hope you guys get the full gist. You know, so I talked about problem, a formula I think would help you. Problem, solution, call to action. And weaving it around what people care. And sometimes what people care about may not appear serious to us. But the important thing is that it's a topical issue, it's a topical story, it's something that is even out of the healthcare space, but it becomes a very important vehicle for us to drive our advocacy. So that it's not just data. And this is why, you know, and also, I mean, I publish peer-reviewed articles once in a while, but I'm really not too much bogged down by that, because I feel that peer-reviewed journals are just full of jargon. Very few people get to read about it, read what we publish there. We just write it in order to have some kind of academic advancement in the academic community. Yeah, I feel that we need to tell stories that really appeal to our people. So if it's the death of Chadwick Boseman, fine. He died of colon cancer. Is an important vehicle to drive advocacy on cancer, you know, screening, prevention, and treatment. If it's the Buga song and a woman using her teeth to open a drink, it's an important advocacy for oral health and why that is dangerous and how that can affect you, cost you a lot, lead to mental health issues. If it's about leadership of public health organizations, we can also use stories, you know, like this when Professor Partey was appointed. And just to speak briefly about this Professor Partey appointment, when I saw this particular data, so Global Health 50/50 is an organization that, you know, tries to, you know, advance gender equity in global health. But in their 2020 report, what they did was that they said, okay, so who leads global health organizations? And again, this is looking at data. So they looked at geography of global health leadership. And what they found out was quite shocking. Low and middle income countries are responsible for 83% of our global population. High income countries responsible for 17%. But if you look at the leadership of global health organizations, it's skewed, it's the opposite. So only 17% of global health leaders from the global south, you know, hold leadership of global health organizations compared to 83%, you know, from the high income countries, although just making up only 17% of the global population. But look at some of the interesting details if you dig deeper. 50% of those 83% of high income country leaders are just from two countries, the UK and the US. And if you look at global health leadership, even in the global south, out of that 17%, only 5% are women. But say the ones that even, you know, kind of shocks me more. 92% of those high-income countries got their degrees in high-income countries, and only 8% got their degrees from low-income countries. And if you look at, again, that data, 8% attended one university, Harvard University. So what it tells you essentially is that it's actually Harvard people who are leading most global health organizations. Is that equitable? So for me, that particular piece I wrote about the appointment, or I wrote for Project Syndicate about the appointment of Professor Partey, was an opportunity for advocacy for us to reform global health leadership. We need to change this. This cannot continue. And to be honest, this report came out in 2020. I can assure you that it has not changed much. It is still happening, although The realignment in foreign aid is going to change that. I know that Christian aid of recent, unfortunately, will be downsizing their workforce, but they are concentrating more on countries where they implement interventions to lead. So I hope that eventually helps us drive the change that we want in global health leadership. So in summary, we can tell our stories through different platforms. Peer-reviewed articles, opinion articles, social media is a very important one because I think that is where people live. More than 3 billion people globally on social media. In Nigeria alone, about 52 million people are on Facebook. In fact, the way I try to interpret that data is that if everybody in Facebook in Nigeria made up a state in Nigeria, it will be the largest state in the country because we know where they live, we know what their interests are, we can target them with the kind of stories. Radio is a very important one, TV, attending conferences. But of course, if you're implementing interventions in different communities, community meetings are really very important, platforms for us to tell our stories in such a way that our people would understand what it is that we're saying and hopefully, lead to the kind of health outcomes that we're interested in. So I want us to end with this particular story again, and I just need 2 volunteers. So I want us to tell a global health story about this particular photo. And I want us to use problem, solution, call to action formula. Anybody wants to take the challenge? 2 people. You can raise up your hand so I can see who is attempting to tell the story. Anybody? Just 2 people or even just 1 person? Tell a global health story now, looking at this image, problem, solution, call to action. Then I can tell you, the story behind this image. Anyone? Sylvia? Okay. Okay, Trace Fire, go ahead.
Okay, for me, when I see this picture, the dogs are street dogs. And
Okay.
people who are passing by the dogs, actually the dogs are maybe enjoying the sunny day. The people are touching them with their bare hand. There is no restriction. So we don't, but the individual have cover on their mouth like a mask, but they are bare on their hands. So we don't know the contamination, the disease transmissions that can come from dogs to individual, like zoonotic disease. So the problem is the dogs are street dogs, the people are touching them. This is the problem. The solution could be the dogs should be, people should be aware of this issue because there could be transmission from individual dogs to individual.
So what would be the call to action? What would you want people to do?
Yeah, to restrain from touching such unknown animals, like we don't know what they have. Even the dog that is on the front of the front one it looks some discharges from discharge coming out of his body.
Yeah.
So
okay.
There could be a problem with these dogs, and the people should restrain from touching that this like these dogs.
Okay. All right. Thank you, and thank you for bringing that perspective. I think you're spot on. Just looking at this image without having any background information about it. Okay, Miriam, Ilemi, can you just speak? Then I will round off.
Hello, sir.
Yeah,
Sorry,
go ahead.
I was in a noisy environment, so I wasn't listening to what the previous speaker said. From the background, I don't know. I feel like there's something going on over there. I can see some people on uniform. It feels like it's giving a kind of pandemic, period, because these people, this family, they are on nose mask. So let's say probably COVID-19. I really don't know what's going on with the dogs.
Okay.
Probably, I don't know whether they are alive or not. So if
All
I'm going
right.
to tell the story, I think what would captivate me more would be, why are these people using a nose mask? What is going on over there? And why
Okay.
is why do we have people on uniform? Who are they? Are they health workers? Are they community workers? You know, something like that.
All right. Great. I like that. Okay. Endurance.
Thank you very much, Dr. Nsofor.
Yeah.
I think just to align my thoughts with what Mariam just said now, what really captured me more was the fact that I can see some persons on uniform there, and these 3 other persons that are actually on nose masks, which implies that there's probably an outbreak of maybe a pandemic or stuff. So, but I think the call to action here is, now there's a pandemic. I'm not so sure these 3 persons touching these dogs are health professionals or health care workers. So ideally, the professional, maybe a veterinary doctor, a veterinarian, should be doing this assessment they are doing, and not they doing it. And looking at it, they are not on any protective glove. They are just using their bare hand, which of course, that will even again not even give them the real protection they are ordinarily supposed to get, even with the nose mask. Having their hand touching the dog's bare hand is not really a good thing ethically. Thank you.
Okay, so thank you guys so much. Thank you for all the stories you've told about this particular image. So let me now tell you the story behind the image. Sorry, who spoke? Do you want to say something?
This is Ibukun here. Sorry, before you answer.
Okay, Ibukun, go ahead.
Yes, I just wanted to add a different perspective, I think, to what other people have said. I think the first thing the first thing that comes to my mind when I saw this image initially was really around how it was really around things like, animal assisted therapy. I think mental health was something that came to my mind very strongly, and how maybe the people in the pictures were just walking by and they saw dogs on the ground. And, as it is with human nature, how dogs can be a safe space, how dogs can provide some form of, non-verbal emotional support to people. Now thinking about it as a global health story, I'm thinking, is there like somebody that's providing this service by just placing their dogs on the walkway where people walking by can just see the dogs and become instantly, moved to pet them, to touch them and interact with them, thereby providing some sort of, therapeutic mental health services. So that's the first thing that came to my mind.
Okay, all right. Thank you so much, Ibukun. And Ibukun, it's great to have you here. For your information, Ibukun was my oga when I worked in Nigeria Health Watch. So thank you so much. Thanks, everyone. So, I mean, it's just amazing the different perspectives that people have. Your network is, sorry, your network is poor. Can you speak again?
Can
Just
you
say
hear
something.
me now?
Okay,
Yes.
try.
Can you hear me now?
Okay, fine.
Yes.
Try and be brief so I can round off. Okay, go ahead.
Okay, sir. So I just wanted to add that there are children. I could see 2 children in the picture, and to an extent be that the dog belongs, and so I wonder what impact it will have
I can't hear you
on
again.
their psychological feel. So
Okay,
I'm thinking
so sorry
of
about that.
the
Network
fact that
issues. Yeah. So, but so thank you guys for your different perspectives on this photo, the stories you've told. It just shows you that for one issue that is topical, there are different angles to tell your stories. Don't let anybody box you into a corner and say this is the only story that can come out of this. All sorts of stories can come out of a particular topical issues, because as far as this session is concerned, this photo is topical. So what is the story behind this particular image? This was in 2021. COVID has really, COVID dealt with everybody in 2020, 2021. By the way, this is my wife and my wife and two daughters. And my wife and I were like, look, we really need a break. Even traveling then was a lot of headache. But we said we had to travel somewhere. So we traveled to Turkey. This was in Istanbul. And anybody who knows Istanbul knows that, or Turkey as a whole, but particularly Istanbul, knows that there are street dogs and street cats. But these street dogs and street cats are taken care of by the government. They are tagged, they are vaccinated. So the issue of getting infection is out of it. And they are just very friendly. And my family is a dog family. My wife and daughters love dogs. So once we got there, we were strolling around one of the waterfronts, and we saw these two dogs just lying around. By the way, it rained. If you look, you see puddles of water here and there. It rained that day. And of course, being dog lovers that they are, they had to pet the dogs. And I felt that my responsibility was to take the photo. So that is the story behind it. It was during COVID. We traveled. We went to in Turkey. The dogs are really well taken care of. They are vaccinated. There is no threat of disease. The dogs are quite friendly. But I like the different perspectives: dog therapy, mental health, all sorts. Thank you for bringing those perspectives. I think that's really what storytelling is all about. So this is my last slide. So in summary, transforming public care requires more than data points and dashboards. It demands a powerful blend of evidence, storytelling, and advocacy. Evidence gives us the facts. Storytelling gives those facts a heartbeat. But advocacy turns that heartbeat into action. And when these three come together, we don't just inform, we inspire. We don't just measure, we move people. And that's how we create lasting change. We really need to move people emotionally. We need to connect to people's emotions. But most importantly, through our storytelling, we need to give people hope for a brighter future, for whatever it is they are facing and dealing with at that point in time. Thank you so much, and I yield. So over to you, Amaponya. My work here is done.
Thank you so much, Dr.
Can you share that slide again, the last one?
You want me to project? Okay, I can send it to you. Is that what you're saying?
Last one. Okay, sir.
Yes,
okay, sir.
but share with the fellows.
Yeah.
Thank you.
All right.
Thank you so much, Dr. Nsofor, for your insights and for your time. And this was really a great way for us to get started in terms of thinking about us being the people who must tell our stories. Us, and for us when I say us, it is everybody here, but specifically the people in the fellowship who are researchers and journalists, because traditionally researchers think that it's journalists who should tell the stories, but the journalists don't have the information to tell the story. But what I'm hoping that one of the things we'll take away from Dr. Nsofor's lecture here is the fact that we all have a responsibility in creating the reality right now with our story, and also in creating the history for those who are to come. And in health, it is that much more important, because we know that when health communication goes wrong, people die. It's literally a matter of life, and we all have a responsibility to make sure that all those stakeholders that Dr. Nsofor mentioned, in terms of they all need to be educated, they all need to, their level of education and knowledge on health needs to be increased. We all have a responsibility to that, and we are so thankful for that. I just want to just quickly check. I know there were some questions, but because of time, we've already gone over time. I'm not going to take any more of our time. I'm just going to thank everybody for coming. Dr. Nsofor, again, thank you so much. our fellows, thank you so much. Everyone who is not part of the fellowship but came, I hope that it was worth your time, and thank you so much. To the fellows, we will be in touch again today with some more information on the next webinar and the continuation of this journey. This is just to get us started. Dr. Nsofor spoke about the different ways we can communicate health, and we're going to get into the details of that so that by the end of this, all of us, by the end of this fellowship, all of us, Dr. Nsofor said that he partook in fellowships that helped him to get where he is now in being one of the most Africa's most 100 influential people, or whatever your goal is, that you have the communication skills when it comes to health to help you get there. Thank you so much, everyone, for joining us, and have a great afternoon, and we will speak to everyone in the appropriate channels. Thank you.
All right. Thank you. Bye.